Today we will be talking to you about the drug Avelumab. This presentation is brought to you by group number 3, Bakir Basarevic, Veronica Bell, Ghazal Blair, Caitlin Brady, and Amber Bramer. Our objectives for today are to learn what Avelumab is and when it is used. We're going to define the mechanism of action of Avelumab. We're going to identify pharmacokinetic features of Avelumab, observe the structure and dosage forms of Avelumab, and investigate the adverse effects associated with this drug.
What is Avelumab? The brand name is Bavencio. It was approved in 2017 and it was manufactured by Pfizer EMD Serrano. The drug is an anti-PD-L1 monoclonal antibody, and it's used in people ages over 12 years old for metastatic Merkel cell carcinoma, and it's also used for people ages over 12 for metastatic urothelial carcinoma that worsens during or following platinum-containing therapy within 12 months of adjuvant or neoadjuvant treatment involving platinum.
Before we talk about Avelumab, we wanted to talk about the cancers that it is used to treat. So the main cancer that we usually see Avelumab used for is Merkel cell carcinoma, or MCC. This is a rare form of skin cancer, and this tends to be most common in people who have light skin and are older. Typically, the average age for these patients that get Merkel cell carcinoma is in the mid-70s. The carcinoma starts in the Merkel cells in the basal layer of the epidermis, and risk factors for Merkel cell carcinoma include UV light exposure, infection with Merkel cell polyomavirus, and immunosuppression. Now, the polyomavirus is a dsDNA virus with no envelope, and since UV light is a risk factor, you usually see most of these Merkel cell carcinomas on the head and neck area. The carcinoma itself is a rapidly growing area. It is usually less than 1 centimeter to a little bit over 2 centimeters. So when you see a patient with Merkel cell carcinoma, the carcinoma will be painless, it won't be tender, it's rapidly growing, the skin is shiny and firm, and you can see it has a bluish red tinge to it. It can often be misdiagnosed as just a benign lesion. These are mostly asymptomatic, and we've included a picture of this. You can see the patient has the Merkel cell carcinoma on her face, which is common due to sun exposure being a risk factor for this. The second type of cancer that Avelumab is approved for is urothelial carcinoma, or UC. This used to be called transitional cell carcinoma. You can see urothelial carcinomas occurring in the renal pelvis, the ureter, or the urethra. The bladder is the most common location to find this, though. Symptoms of urothelial carcinoma include hematuria, urgency, dysuria, nocturia, and frequency. The gold standard for diagnosing a patient with urothelial carcinoma is a cystoscopy. And when evaluating the severity of the tumor, they will have to take out part of the tumor and evaluate the histology of it. This is called TURBT for short. It stands for transurethral resection of bladder tumor.
Dosage form and strength. Avelumab is currently only available in brand name Bavencio. The dosage form is a preservative-free, non-pyrogenic, clear, colorless to yellowish color solution, and it's only for IV administration. It comes in 200 mg per 10 ml vial and is single dose vial. Each vial of this medication contains 20 mg Avelumab, 51 mg D-mannitol, and different other excipients. The pH of this solution range from 5.0 to 5.6. Chemical structure of avelumab. The primary structure. Avelumab is a human immunoglobulin G1 monoclonal antibody directed against the programmed death ligand 1 molecules. The recombinant antibody is produced in and contains 2 heavy chains. In the picture, it's colored gray, and 2 light chains. There are colored blue in the picture, with antigen PDL1 binding and FCR binding regions.
Using avelumab can lead to certain immune-mediated adverse reactions. Some of the reactions are pneumonitis, hepatitis, colitis, nephritis or renal dysfunction, and certain endocrine disorders such as adrenal insufficiency, thyroid disorders, type 1 diabetes mellitus, and diabetic ketoacidosis. To monitor for pneumonitis, you can use radiographic imaging. Hepatitis, colitis, and nephritis are all treated with corticosteroids if they pass stage 2. For type 1 diabetes, we can monitor their blood glucose, and for nephritis, we want to monitor their serum creatinine levels throughout treatment. Avelumab can also cause some adverse reactions just from having it infused into the patient. Some of those reactions include fever and chills, flushing, urticaria, hypotension, dyspnea, and wheezing. These are all pretty basic adverse reactions from any infusion. However, most of these can be avoided by pre-medicating the patient with an antihistamine and acetaminophen before the first 4 infusions. After the patient has had 4 infusions of avelumab, the prescriber or physician can use their clinical judgment to decide if they need to keep pre-medicating the patient with these before all the treatments. There are also some general adverse reactions related to using avelumab. Those include fatigue, musculoskeletal pain, nausea and diarrhea, anorexia, peripheral edema, lymphopenia, and anemia. Most of those adverse reactions are going to be seen with most of our cancer treatment drugs just because of how they work in the body. Avelumab is contraindicated in pregnancy and in breastfeeding, and they do occasionally see urinary tract infections in the patients that are using avelumab for their urothelial carcinoma treatments.
Okay, so now let's talk about the mechanism of action of avelumab. But before we look into that, we need to understand the normal interaction between cancer cells and T cells. So cancer cells, because they are mutated, they may have an overexpression of PDL1, and the L just stands for ligands. So it's basically a signaling molecule that is capable of binding to PD1 receptors, which are located on human T cells, which are part of our immune system. So when this interaction happens, the ligand binds to the receptor. The cancer cell is tricking our T cell into thinking that it's not a cancerous cell. This way, the T cell won't want to kill the cancer cell, which we are not in favor of. So this is where a drug comes into play. Avelumab is a PDL1 inhibitor. So we know the PDL1 is on the cancer cell, so avelumab binds to that ligand, preventing it from binding to PD1 receptors on the T cells. So now, since that didn't happen, the T cell will identify the cancer cell and will proceed to eliminate it. And on this slide, we have what I just explained, but it's in a picture form, so it's easier to visualize. On the left-hand side, we don't have the drug. It's just a T cell and a tumor cell. The end result here is the T cell won't be able to identify the tumor cell as being cancerous, so it won't kill it. And on the right-hand side, we have our drug involved. There's a little arrow pointing to it. It's a PDL1, so it's on the ligand. It will stop it from binding to the PD1 receptor on the T cell. So the end result here is the T cell will identify it as being a cancerous cell, and it will go ahead and try to kill it.
The pharmacokinetic features in patients who receive doses ranging from 1 to 20 milligrams per kilogram every 2 weeks, where the absorption is completely absorbed because it's an IV. The bioavailability is 100%. The distribution at steady state with a dose of 10 milligrams per kilogram every 2 weeks is 4.72 liters. The metabolism is by proteolytic degradation, and it's not excreted in the urine due to the large molecular mass, and the main source of elimination is via the metabolism into peptides and amino acids, and they are excreted via the kidneys or recycled for de novo protein synthesis to be reused in the body. And the elimination half-life is around 6.1 days. The clearance is expected to decrease over time in patients with Merkel cell carcinoma.
And that brings us to the end of our lecture on Avelumab. Thank you so much for watching, and our references are on the next couple of slides. Thank you.